based in Bangalore. She's a pioneer in women's wellness and health. She runs her own clinic as well as she's practicing in multiple clinics as consultants. But beyond all that, the kind of bond that I share with Dr. Yasmin, she's been my doctor. She's delivered my third born. And she's also a very dear friend from Bangalore. I actually witnessed working with her, her passion for bringing, increasing the clinical standards and especially hygiene in terms of women's health when we work together in a couple of medical camps for women in slum areas in Bangalore, and we share very similar views about bringing women's wellness to a global standard. So, Dr. Yasmin, a very very warm welcome to you to W4W platform. Today, this is not just another session for me. I believe there are a lot of doctors who have logged into this session because we are dealing with a very, very specific topic here. So, we've been having a special interest group regarding perimenopause. I'm sure that you've been told about this by Rania and other people who are coordinating with the session. Dr.
Okay.
Yasmin, is it okay for you to keep the camera on?
Okay.
You don't mind? Yeah. So, same I would request to other people also who are there logging in. It's always important to see who you are speaking to when you're handling very, very sensitive topics like the one we have today on our forum. So we've already had a session focusing on perimenopause. We had it with another doctor, but there were a lot of questions that we as women, we couldn't really share with a male counterpart who is from the same profession. Though the person is very good and understood all the concepts and all the problems that we were sharing. So during that session, something that came up is that how do we handle or how do we manage sexual health during perimenopause and menopause of women? So there were a lot of questions that we were, that we received in the as queries during the session, but people were very hesitant to share it with a male doctor. I believe that is why we trust you that that you can understand where we're coming from, and you will not probably see the intention of the question in any other manner. So, all you ladies out here, thank you for logging in for this session. And I would really request you to open your camera to make this a discussion rather than a monologue. Though we have your questions with us, we'll be sharing those questions very soon. So, Dr. Yasmin, over to you. You can start the introduction, then I will take up the questions as we go along.
Thank you, Nisa. Thank you so much. It's been my pleasure to be introduced in this platform and to help you lovely ladies, because I know these are very sensitive issues, and always the women are hesitant to ask these issues. So when we have another woman on the platform, so then it is easier because then we can discuss, and it is very very important that we are aware of our body, so that we can take the adequate precaution before we fall sick, because we women, we are the backbone of the everything. So that's why we have to be fit first so that we can take care of the whole world. So I will start my session. Good morning to all of you. So I have a PPT, Nisha. So I was thinking I will just give a brief overview and then we can take the questions so that at least everybody will have some idea.
Yeah, that will be absolutely fine. And maybe some of the questions will automatically get addressed in the PPT. Then, I'll open up the platform for more questions. Okay. Thank you so much.
Okay. Women will be more prone to osteoporosis, usually after menopause. And it also causes brain fog. So this hormone is very, very important. And this is the hormone which starts fluctuating and then gradually it will go down. Your next hormone is the progesterone. This is also very important. I think most of the women, you will be knowing, around this age, after 40, usually you'll be having some irregular periods, heavy periods, anxiety, irritability, or poor sleep issues, if you can relate with all this. This is all because of this progesterone hormone. Normally, it is the calming hormone. So, this progesterone, which will cause all this bleeding problem, is also very important at this age. Then another one is the testosterone. Testosterone, actually, women also has this, but in lesser amount compared to male. Now, why this is important? Because it reduces your energy, muscle tone, and the sexual desire. So, testosterone should be there in some amount. But in the perimenopause, this hormone also comes down. So now, why this is important? What are the common symptoms you might notice? Why, when you should like be okay with the symptoms, when you should not be okay and visit the doctor. So for some people, as long as like they will be able to manage, they will usually not go to anybody. But it is not about managing; it is about affecting your quality of life. So what are the cycle changes in the period patterns, irregular cycles? You might have sometimes heavy bleeding or light bleeding, or periods might come very frequently, sometimes 2 times in a month, or it may be skipped altogether. Now, regarding the sleep and all, hot flushes. Hot flushes means suddenly you will feel hot and sweaty in the face. And when everybody else in the room is feeling normal, you will be suddenly feeling very hot. And then you will want for some fresh air. So that is called hot flushes. Sometimes evening, like night, when you are sleeping, suddenly you will wake up sweaty. That is the night sweats. And sleep quality also will go down and you will feel easy fatigability. Now, mind and mood changes. I think everybody goes through this brain fog. Suddenly, we forget what is happening. Then, low motivation will be there, anxiety, and in the body, physical symptoms like reduced libido, vaginal dryness, and weight gain. So, these are all the various symptoms how menopause or perimenopause can present itself. Now, what should we ask ourselves? Is this affecting my quality of life, relationship, sleep, or work? Yes. If it answer is yes, then support is available. So this is what I have told. Now, so this is not your failing body. It is your body changing and help is available. So now here we are in a safe space. So any changes, desire, comfort and confidence, they are very common. So they are the biological issues and that can be tackled. Next. Now regarding the sexual health, desire, intimacy and dryness. So now what happens is, as I have mentioned, all these hormone changes can affect your tissue comfort, your arousal speed, orgasm, motivation, and confidence. They are all valid clinical concerns. Now, mostly you will feel that there can be some vaginal dryness. Why does this happens? Lower estrogen, it makes the vaginal tissue thinner, drier, and more sensitive. So sometimes some people will have like they will have little pain during intercourse, and sometimes some people even might have light spotting. So this lower testosterone may reduce the desire and the motivation, but this is the biology. And many women shift from spontaneous to responsive desire. That means they do not feel aroused unless and until they have the intercourse. Only then slowly they will be okay. And then there's a fear of pain, again because of dryness, body image, and work stress can also reduce this desire. Now, what are the solutions? So we have various solutions available. So these all symptoms are called the genitourinary symptoms of menopause, and it is treatable. So you don't have to suffer silently. So vaginal moisturizers are there, can be used not only before sex, but it can be used regularly also. There are certain lubricants like water-based gel we have or silicone-based also. We can apply this so that it is facilitating the intercourse and it is less painful. Again, because I have mentioned that the mucosa becomes very thin, that vaginal lining. So there are some hormone replacements because there can be tablets, there can be inserts, means which you insert in the vagina. So this all improves the quality of the mucous membrane and it makes the sexual life better. And there are some medicines like osmifen. People don't use much, but we have those available here. Now,
Doctor, just one question.
yes.
These medicines that you're mentioning, these are over the counter or you need a prescription
No,
to?
no, no. Actually, you should not take it because again, I was thinking whether should I mention these names because thing is, see, everybody is different. Like because normally whenever somebody comes to us, we will see the BMI, the family history, any risk factors like high BP, weight, because all the medicines they will have some side effect or the other. So what we usually do is depending upon what is affecting most, means what are her most common symptoms, her body profile, her risk factors, we usually treat all this. So usually it is available, but I think better not to go for over the counter things, means better go with the
Yeah,
prescription.
that's one thing I wanted to clarify because a lot of women here have asked vaginal dryness and discomfort are common concerns. So what are the safest and the most effective ways to manage them? So I think it is very common knowledge that you have a problem, you have to approach a doctor, you have to consult, and you have to specifically come to a conclusion regarding what is going to work for you. But the general attitude, like you also know, is that they want to manage without telling people. There are some element of shame in discussing these kind of topics. So one message I just wanted to share here while you are here is that we'll be sharing your coordinates also in the group. So women who would like to actually get in touch with you, I think you will be more than happy to guide them. So this is a message I want, because when you mention some medicines, the first the thought is to, okay, I can buy this and I can find a quick fix to my problem. So please, all the audience, this is for you, that though she's mentioning some medicines, please understand this is not one thing that can fix everything for you. You need a customized solution for your problems. Please go ahead, doctor.
Yeah, and your body, how they will react also, you don't know, because tomorrow something should not be, you should not be into more loss than benefit. So that's why we there, that's where we come into picture. So now, see, these are the things, next slide. So this is important, because common healthy things, whatever you can do, that everybody can do. So now, what are the lifestyle changes? Lifestyle changes plays a big role in this. So what are the lifestyle changes? Like pelvic floor exercises, that all you can do unsupervised, no problem, and pelvic physiotherapy. So what it does is it will tone up the pelvic floor muscles, it will increase the blood flow in the vagina, so that at least the function will be little better. Then 150 minutes per week movement plus strength training. That means roughly you can say 30 minutes per day is bare minimum you should be doing. Some cardio you should be doing 30 minutes a day. Then again, strength training. For women above 45, strength training is a must. There should be no compromise, because the muscles, the BMR and all will go down. So what happens? You have to artificially strengthen. So you need to do some strength training. That is for everybody. Then this common things like flaxseed, which has omega and all, soy. So these are all you can take, no problem. Omega-3 capsules, these are all nutraceuticals. Calcium, again, after menopause, because as I said, because of the declining hormones, the bones will also like have a tendency for osteoporosis and all. So that's why you should be taking calcium after menopause. Then vitamin D. Nowadays, 90% of the Indian population, vitamin D will be deficient. And once you take, it will go for 2 years, again it will come down. So these are the common supplements you can take, and you can see. Make sure get your blood works done, whether your vitamin D levels, especially what I like in our community covered. If you are covered, like then what happens? The vitamin D levels will be lesser. So that is very important to get checked your vitamin D and B12 levels. Then again, for sleep protection, what do you do? Mindfulness or that CBT. CBT means some behavioral therapy is there for stress and hot flushes. So this you can do safely. Now, one very important thing, because as women, mostly what happens is some tests are there. This is our health check. What we should be doing is pap smear. This I have not put here, but I just wanted to share. Pap smear, this is a test against cervical cancer. So what we should be doing is, after people are sexually active, 1 in 3 years, it is the minimum you should be doing till the age of 65, because cervix is the mouth of the uterus. So what happens? Any changes, like any infection, we can pick it up and we can treat, because any infection, then to go into cancer, it takes like 15-20 years. We have that much time frame. So if we keep doing this test regularly, then we can protect ourselves from those kind of things like cervical cancer. Then again, after you reach the age of 40 years, there is another test which is called the mammogram. So mammogram is for breast cancer screening. So once in 3 years, you should be doing the mammogram as well. These are all protective measures. Nowadays, one HPV vaccine is there. So ideally, when it's like started from young girls from the age of 9, but it can be given up to the age of 45. So at least some protection will be there. So these are the preventive checks, actually, what we can do. So now, coming back to our topic. So what I was telling is all the sexual changes and all, whatever is going in your body, how do you talk? How do you communicate to your partner? Because that is the most awkward part, actually, because we don't want to discuss all these things, not even with our partner. And sometimes what happens is, I have noticed that like when patients come to me, they only can talk to me, but they don't feel like telling this to partner as well. So what happens? Sometimes because the pelvic floor muscles will become weak, So what happens is sometimes they will have incontinence problem. Incontinence means either you will feel like when you are laughing or when you are coughing, there will be some leakage of urine. That is also because the support will be gone. So that can be one thing. Sometimes during intercourse, some people will have little bit leaking of urine. So these are very, very intimate issues and very, very difficult topics to handle. So now what we should be doing is we should talk this with your partner, and not that suddenly we will tell. We should pick a calm private time, not during or right before intimacy, and then we should communicate that, see, I have been feeling more sensitive lately, and when want to share, this is what is happening. These are some lines which can help you like open up to your partner. And then, because initially when we are young, because the vaginal health is very good, so any intercourse and all, it is not painful. But now because the vaginal support is little bit weak and vagina is less friable, so gentler touch, maybe we can say please go slow, or we can use some lubricants, or we can pause when required, because sometimes it might be painful. So we can tell this beforehand only, so the partner also will be prepared, because it's not their fault. They should also understand. And then sometimes what happens, not only about this physical intimacy, but the touch, closeness, connection, that also matters as much as intercourse. So another one important thing is you can bring your partner also for consultation if that is helpful, because when the doctors tell them, usually they will also understand. And then it's not like you telling, it is like the medical thing, it's the biology telling. So then they also get a better picture about this one. So acceptance is better, I mean to say. Now, so when sexual health symptoms need medical help, do not normalize any pain during intercourse, distress, or bleeding. So these are very common reasons. So, and you have, good thing is you have the treatment option. So when do you come to see the doctor? So whenever your sex is painful or it is affecting the quality of life and you have no desire for months and it is distressing, your partner is also frustrated because you don't feel like doing it all. So that is not normal, because yes, desire will go down, but it should not be like totally nothing at all. And then bleeding, you are having bleeding after sex or after menopause. And sometimes what happens, you have used some things, but dryness is like, it's a terrible dryness. Every time you are not able to have intercourse at all. And again, urine leakage during sex or activity, or like it is affecting your quality of life, or severe hot flushes, you are not able to manage, or you are getting upset, irritated over very small and little things. So these are the times when you should come and seek medical opinion. Because see, what we do normally whenever we come in, what I have seen is in Indian women, if you say the hormone replacement therapy is there, usually people have a taboo against all those things, because sometimes for some people what happens, these hormones can have side effects. But again, these are not like for everybody, it is not a blanket rule that we give. First, initially we try with lifestyle things, then we go for the safer alternatives which are not hormones. Once those are not effective, then only we go for the hormonal therapy. And it has actually very promising results, all these therapies. So what we should do is, we should always visit the gynecologist. Now again, see, local estrogen creams are there. So local things, I think there is no hesitation to apply the local creams, because you can apply the cream and it has to be used for some long period of time, like 2-3 months. Then you will get the desired results, because at least your sexual life will be better. And then testosterone therapy, that again, like with in severe cases only we give, otherwise we don't give. But we initially go for the vaginal insertions, like the creams, tablets, then pelvic floor physiotherapy, your sex therapy, behavior therapy, mindfulness, sleep, fixing the sleep. So all these things are very, very important initially. So now what you should tell yourself, you are not entering your decline. You are entering a new chapter with the right information and the right support. And it does not mean to have to mean suffering. Nowadays, they are saying the quality of the expectancy, age expectancy is increasing, life expectancy. So when life expectancy is increasing, that means people are going on to live longer, like 70, 80, 90 years people will live. Now, when you are going to live that long, so your menopausal phase will start from after 50. So after 50, that is the average age in India. So you have another 20, 30 years to live after menopause. That is why this menopausal phase is very, very important, because you should be fit and active so that you can be in that long phase, 20, 30 years, it is not suffering. It is enjoyable phase of your life. Again, now what I was telling about that bleeding pattern because of the declining progesterone. So, which is normal, which is not normal? See, whenever you are getting your periods on time, fine. If it is coming after every 2 3 months, that is also fine because of it's in a natural phase and gradually it will decline. But when it is not fine, suppose it is eighth day and your bleeding is going on, that is
Mm.
not normal. If there are big clots coming every time when you bleed, or you are changing pad every 2 3 hours or every 1 2 hours, then you need to see the doctor immediately. Then bleeding after intercourse that can suggest some infection. So every time if you have intercourse, some bleeding is there, then that is also infection. You need to get it checked immediately. Again, suppose your periods have stopped for 1 year completely, you have no because this is a common question which many people will ask. I didn't have a period for 1.5 years. That means menopause confirmed. And now I am having bleeding, spotting, brownish discharge spotting. That is not normal. Any bleeding after 1 year of no periods is not normal. That can be an early sign of cancer, and also immediately we should visit the gynecologist. Again, severe pelvic pain, like unexplained pain, worsening, not letting you do your normal work, so which affects your quality of life, like your sleep, your work, your mood, intimacy, or daily function. So these are the things when you should be visiting the doctor, because everything has a solution. Now, why heavy bleeding? Most women will neglect this heavy bleeding because they will be able to manage. But now heavy bleeding, what like the uterus has a lining, so that comes out as bleeding. Whenever it is heavy, that means sometimes this lining can become thick. Again, if it is thick for some time, like 4 5 years, then this heavy bleeding can turn into precancer and then cancer. So that is why it's always important you immediately get it checked. Now, long-term health. So as I mentioned that these hormones protect your bones, heart, and metabolism. So women usually you will see they will not get a heart attack unlike men in the young age. Usually after menopause only women will get heart attacks and all, because the natural hormone estrogen is doing the protection for women. But now once this comes down, then we need to take care of the bone health, heart health, and metabolic health. So bone health, especially osteoporosis. So what can be done? As I mentioned, strength training, very, very important. You should be doing. Then calcium supplements, vitamin D should be optimal. And then you have to see that you prevent fall, because after this particular age, because the bones will become little bit weaker. So whenever you fall, there will be more chances of fracture and all. So we should be very careful in that also. Then heart health. Heart health means we should do the normal checkups, like cholesterol should be under control, BP should be under control. So regular BP, lipid checks, movement, sleep, and no habits. Then metabolic health. Metabolic health means weight gain and diabetes risk increase. Sometimes what happens, you will notice that around menopause, the belly fat will increase and people tend to gain weight faster. That is because the BMR will drop. Once the BMR drops, you tend to, like with the same amount of food you are eating and same amount of activity you are doing, you will gain weight easily. That is why you have to either eat more healthy or you have to do more exercise. You have to include proteins, fiber, resistance training, and keep checking your weight and your diabetic parameters. So this is very, very important. If you do all these things, then I don't think so that there will be much of a weight gain and all. So early lifestyle changes can significantly reduce the future risk. Start before the symptoms become severe. Now, what all things you should include?
Doctor, one very important aspect I just want to bring to your attention. So we are
Yeah.
talking about how to communicate about our condition to partners, how to what to look out for, when is the right time to go to a doctor, and all that. But I think what gives every woman that courage to do all this in the right time is the ability to manage the mental health while all this is going on. So I think only when you're in the right frame of mind, despite having the brain fog, despite having all these issues, you will be in a position to decide, okay, I really want to seek help. So what are the few things, maybe after discussing the lifestyle changes, maybe we can also discuss what are the few things that will actually give us that capacity mentally to be very present with ourselves, to understand, and become aware of what is going on, so that we can, flag it off at the right time, that this is the time where I want to go take help. This is the right time where, I really need to step up for myself. I think a lot of women do not prioritize taking care of themselves, and do not really take this seriously when something is going on. So I think it's important to discuss the mental health aspect also, as far as from your experience, like, what can help.
Yes, yes, this is very true. Actually, this is the
Yeah.
most important part because women feel like um, basically that confidence level. Okay,
Yes.
so what happens? You are so much juggling with all the other things in your life, like family, their work, day-to-day pressures. So then you forget to take care of yourself. But then again, see, as I have mentioned in the start of my talk, that if you are only healthy and active and fit, then you can take care of the other people in the family. So now, mental health actually, I think this is a very, very important thing nowadays, mental health. So, mental health means how? If one thing is there, if your physical health is good, like if you're physically fit, then your mental health also automatically, because one aspect of your health is already taken care. So you know that you are doing, like you are in your optimal weight, you are eating right, then you are sleeping on time, you are taking care of your exercise routines, water intake. So when that is taken care of, I think you feel some confidence from inside that I am doing the correct things. So when you are not physically sick, sometimes what happens, if you say no, 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 I'm gaining weight, then my this symptoms of cut, my bleeding is also not under control. So then that affects your mental health also, because you feel out of control. So whenever you feel out of control, that is the time then mental health also takes a toll. So you go into depression, and then what happens, it goes in the downward spiral. So that is why it is very, very important that at least physical care you should be taking. Second thing is, I would recommend that you do some, like for us, so it is very good only, like when we fix our routine with our 5 daily prayers. So what happens is, say like morning time we fix that this is our routine. So we do take out some time for exercise also in that morning time. So then what happens, and always you have to talk positive to yourself, self, like positive self talk, because sometimes what happens, the whole world is there to tell negative things, why you are doing this wrong, why this is not like done on time. So many things will be there. So what I feel is help me is, you should keep telling positive things to yourself. Otherwise nobody will tell you positive, you are good at this. You should know your strength, you should know your matlab mainly, see, weakness everybody will tell this is your weakness, but we know what we are good in. So you have to think one day that what are my strengths, note down these strengths, and every day tell yourself these are my strength, I am doing well, because nobody can be perfect. So when you keep telling all these positive motivational things to yourself, plus read some self-help books, because nowadays so much of information is out there, but again it should not be a overwhelming information. But for mental health this also affects taking care of yourself physically, then telling yourself, giving yourself confidence, spend time with people whom you like, whom you feel supported with. That is also very important. Not that you are only busy with work and your family. You have to have some friends whom you can share at least important things, because that helps so much. Well, helps, like it's a contributing factor. And then keep some time for your hobby in the sense, like suppose you want to, you write, you like reading books, suppose you like to go out, you like to do some shopping with friends, so keep a time for that also. So that gives you some mental relaxation and well-being. So it helps you that you do not fall into depression. Normally when you see that you are overworked and all, immediately you'll feel so bad, but when you meet a friend everything goes down. Or maybe sometimes some people, they will talk with relatives like mothers and all, so that also gives some support. So basically you should know what helps you. That is very important, and you should prioritize yourself. As Nisha has rightly said, prioritizing is very, very important, because if you don't prioritize yourself, then other people will drive you. So you have to take the seat, driver's seat, and you have to control the car. Otherwise, other people will come and tell you what to do, because you don't have control over yourself. And how you will do that? By knowing yourself well, by doing things you like, doing the right things, and taking care of your health. So
Thank
does
you.
that
Thank you,
help?
doctor. So I think this is one important question on everybody's mind: how to manage our energy level, how to manage our, thoughts. Because see, the same woman, one day 7 o'clock in the morning, full of energy, jumping with joy. The next day, down in some valley because the energy level is so low, and they don't want to. So I think there is a lot of confusion as to our own identity when we go through this change. I think that the challenge here is more psychological. I would say as much psychological as it is physical. So, one more invitation to the whole audience here is, pick up the phone, call forums like W4W, where there are people available to listen to you without judging you, without criticizing you, without giving solutions to your problems. If you want to talk to a thinking mind, that option is also available today with platforms like W4W. So I think human interaction, like Dr. rightly said, speaking to people at the same wavelength with the same level of energy can really, really pull you back to who you are. So I think along with all this, one important lesson, apart from the science and the medical facts behind this, one important thing we need to keep in mind is you need to be your own champion. Like Dr. rightly said, if you don't prioritize yourself, the world is not going to make it easy for you. So I'm sorry, Rania has raised her hand. I would request Rania to also share her thoughts at this point. Doctor, I hope you don't mind.
Yeah, yeah, no problem.
Yeah, Rania, please go ahead.
Thank you so much, Doctor, for being available here at 9 a.m.
No,
early
no,
in the
no, thank
morning.
you.
Doctor, when I had shared the poster, I have got a question. Um, what is this perimenopause? All of a sudden, everyone is sharing about perimenopause, and we've never heard that before. So, what is this new thing going around? So, usually, I get this question from uh, elder ladies, the age of my mother-in-law, like probably late 50s, 60s, because she says that we've been through that age. We never felt like this, what you girls are saying now. So what is this? Is this something new that is happening around the world?
No, no,
So
no.
what?
See, actually, I understood your question because as this was the first slide of my presentation. Okay, perimenopause. Perimenopause. Normally now there's there's so much knowledge because people are fully aware of their bodies. Now patients will not simply come and they will tell no, 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 we don't know anything. Like our parents' time, what used to happen? They used to have menopause, but they used to keep quiet because they never voiced out what they were feeling, what they were suffering from. They were okay with everything. But now people are not okay because we know, okay, this is our body, these are the hormones. So perimenopause means the phase before we are menopause, and it can last quite long. 2 to 8 years is a big time. So why should you suffer with all the declining hormones and those symptoms? So that is why perimenopause has gained a big popularity in today's time because and life expectancy also has increased. So people have to manage this perimenopause and menopause age very, very well. So and there are so much help and all available. So that is why this years prior to your menopause, which is called the perimenopause, it comes with its own symptoms, as I am telling. So this like your normally mood, mental changes, then physical changes, so emotional, all those things, this comes with that full package which can be easily taken care of if you are well aware of your body. So that is the thing. So you don't have to suffer in silence. Our mothers means they will think why you are making a big issue of all this. Sometimes husbands will tell why everybody is working. That day one pregnant lady came. She was having too much of vomiting. The husband is telling, Madam, itna ye karti hai, matlab, she's showing too much. So then I said, no, it is not that she is showing too much. It is her hormones because the hormones are bad. That is why this is happening. Sometimes husbands will think, no, 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 wife is just to escape work. They are telling me I'm not feeling good. But actually it is not she is feeling not good because just like acting, it is because of the hormones. So if we understand, we can make our husbands also understand that this is the reason why I am feeling like this. And then we can take care of this together.
So I think one thing that perimenopause is being talked about so much today is that women stop normalizing pain. Earlier, I think pain was an integral part and parcel of womanhood. If you have pain, it's okay. You normalize it. You carry on with your life. I think this is a change that has happened in every aspect of our life that, we stop normalizing pain. I think that is the beginning of a lot of changes that we see, a lot of conditions that we talk about in our society. And yes, I think genuine efforts should be made to bring out, what can be done. So yes, please continue with your presentation, doctor. Sorry for the questions. Like in between, when something
No,
comes
no,
up in
no
the chat,
problem. Otherwise,
I'm putting that across. Yeah, yeah.
yes,
Please
yes.
go
No,
ahead.
that is
Yeah.
very true. What you said is because we have to
Mhm.
stop normalizing and start taking action.
Yes, yes.
No, I think that last one or two slides will be there only.
You were talking about the food habits, if I'm not mistaken.
Food habits
When
is also very important. So this is a small thing, but it affects in a big way. So what you
yes,
do, how you build the plate. This plate you can see the photo. So what it has all the proteins. So there should be make sure every meal should have some protein, and there should be enough calcium and calcium, vitamin D supplements you can take. Vegetables. Some people they don't take any fruits at all in the diet. So there should be at least 2-3 servings of fruits in your whole day. So whole grains, fruits, vegetables should be taken. Water intake should be at least minimum 2.5 to 3 liters. And if you have a habit of taking coffee, make sure that tea and coffee totally it should not be more than 2 cups, because that is it should be within a safe limit. And then again after 4 o'clock you should try not to take any coffee, because it affects the quality of the sleep and even sleep also. So all these things, basic things, if we keep under control, like that carbohydrates again, sugary and highly processed. I think everybody knows all these things, but only thing is we need reminders so that we can keep doing it. So sugary and highly processed foods should be avoided. Then smoking excess alcohol, skipping meals during long work days. Sometimes we are so busy that we do not have time even for our meals. So that should not be the case. So again, we should prioritize ourselves, our food, our body. And then another one very important thing is hot flushes. So how do you manage these hot flushes? Apart from the medicines, that is second step. But the first step is what you can do is if you know that, okay, I feel very hot and sweaty, try to sleep with some cotton clothes. Cotton means breathable fabrics so that you don't feel very hot. And then you can keep the room temperature little bit like AC you can put as per your comfort, and keep some water nearby so that you can hydrate yourself whenever you feel that. So short this hot flushes when you are getting, sometimes people will keep going to the toilets in the night. So that is why make sure that after 6-7 o'clock, do not drink too much water. Otherwise, your trip to the bathroom will become more frequent and sleep will be disturbed. So, for hot flushes, you make sure you are adequately hydrated, wear comfortable clothes, keep the room temperature warm, and sometimes this magnesium supplements and all also you can take. It's not that you keep taking, but yes, 2-3 months you can take. That also helps. And then what happens is you can talk with your like family members or your workplace sometimes, that yes, everybody goes through this phase of life, so it is nothing like abnormal or nothing that everybody understands to in today's world, because the knowledge is so much. And then as I told regarding exercise, so exercise is the medicine for the bone, mood, sleep, and confidence. So if you keep doing your exercises, you don't have to take more of medicines. So as I mentioned, 30 minutes every day. Then your strength training, all of you start from today. At least like from the age of 45, strength training is a must. And you see the changes in your body. Do the pelvic floor exercises, the Kegels exercises. So that squeezing you should do, because you don't end up in incontinence. That is important. So it will support your bladder as well as your sexual health also. Intercourse time also, then it will be like the muscles will be functioning well. Yoga, you can do mobility exercises, strength training, and avoid fall and all. Again, now, see, this is the most important. Whatever I have told, it is not that one size fits all. So again, it depends upon your age, your severity of the symptoms, what is your other medical issues, how much, what family history is there, and how much your body can tolerate the medicines. So that is why lifestyle, anybody can do. Non-hormonal medicines, mostly safe options because they are not the hormones. So that helps most 90% people, it helps. After that, if that doesn't work, then we go to the hormonal therapy. And these local options are always the best options. And lastly, not the least, because nowadays so much help and support is available. So you get counseling support, like Nisha mentioned, be it W2W. So you get people who can talk with you and understand you, so you feel supported. So your mood, anxiety, sleep, intimacy, impact, all this can be helpful. So menopause means life is not over. Okay. It is a new phase of your healthy living, leadership, and self-care. And every woman needs hormone. That is a myth. No. You can be actually based on your symptoms, medical history, individual goals. There treatments, various sorts of treatments are there. Again, some people will think, no, my weight gain is unavoidable. Not like that. If you take enough protein, you do strength training, take care of your sleep and stress, you can help protect your metabolism. Again, brain fog. They say some people will think I am not able to cope. But thing is, this sleep disruption, hot flushes, and stress, it can affect also your focus. So if you fix those issues and get proper support, that can be also taken care. So take home message. What is the take home message for everybody? Perimenopause is a natural transition. It's not a personal failure. Every woman goes through this phase. It is up to you how you take this phase. Whether you are conscious about this, whether you are pre-informed and taking adequate steps matters. Then trackable. Track your cycles. Track your if you have hot flushes, sleep and mood. You can consult for take all these measures so that you know what is happening with your body. Then manageable symptoms can be treated. You do not have to just tolerate it. Then bone, heart, and metabolic risk respond to early lifestyle action. So before you fall sick, if you take care, you will not fall sick. And do not ignore the abnormal bleeding or severe pelvic pain. Consult a doctor that time. Then medical, mental health, workplace support can work together to help you grow stronger in this phase of life. So understanding your body is the first step towards better health. Thank you.